stem.
Yes, ma'am, I got.
Okay, right. So if you've read and understood, considering it's surgical anatomy station, please have a look at the diagram and tell me what exactly are you looking at.
Yes, ma'am. This is the triangle of the neck.
Okay. How the triangles of the neck divided, or how would you
It's
classify them?
divided. It's divided by the sternocleidomastoid two compartment, anterior triangle and the posterior triangle.
Very good.
Anterior triangle
Can you
against up.
just a second, please? Can you look at the diagram and tell me which is labeled sternocleidomastoid? Which number, please?
Yes, sternocleidomastoid. Ma'am, I cannot see the numbers.
1, 2,
Yes,
3, 4,
2, 3,
5, 6.
4, 4, 4,
4.
4, 4.
Very good, very good,
Yes,
very good. Please tell me the origin and insertion of sternocleidomastoid muscle.
yes. It's arise from the two head,
Yes.
sternal head and the clavicular head, and insert into the occipital bones.
Very good. So anterior compartments are further divided in how many compartments and by
Yes, ma'am.
which structures?
Four
Please?
compartment.
Very
Four
good.
compartment
Very
by
good.
the anterior belly of the digastric muscle and the
Yes.
superior belly of the omohyoid muscle.
Very good. Yes.
By submandibular, muscular, and the carotid triangle. 4.
Very good. Okay. Please tell me the contents of the carotid triangle.
Yes, ma'am. It's contain the carotid sheaths and the ansa cervicalis nerve. Carotid sheaths contain the common carotid artery, internal jugular vein, and vagus nerve. And
Very
ansa
good.
cervicalis outside this.
Very good. Okay. All right. Coming back to the posterior triangle, can you tell me posterior triangles are further divided in how many triangles?
Yes,
And
it's two triangle by the inferior belly of the omohyoid. One is
yes.
a supraclavicular triangle, another is occipital triangle.
Okay. Please tell me the contents of the posterior
Yes, ma'am.
triangle.
Yes, ma'am. It includes the some vessels like the third part of the subclavian artery, transverse cervical artery, suprascapular artery, um, external jugular vein, and the
Yes.
nerve includes the brachial plexus, root and trunk, spinal accessory nerve, some muscle, inferior belly of the omohyoid muscle,
Yes.
and the limb nodes includes the supraclavicular and the occipital limb node.
Very good. Okay. Right. We are moving next. Please tell me what exactly are you looking at? How many organs can you see?
Yes, ma'am. It's the dissected view of the cadaveric image, anterior aspect of the neck.
Okay. Showing you.
Showing the thyroid gland.
Yes. What are the parts of the thyroid gland?
Yes, ma'am. It's two parts, two lobes, and connected by isthmus.
Right. Can you identify isthmus in this diagram, please?
Isthmus is now E.
Structure E. Very good. Please, right. If you can tell me the blood supply of the thyroid gland, both arterial and venous.
Yes.
Thank you.
Yes, ma'am. It's supplied by superior thyroid artery, which is first part of the external carotid artery, and inferior thyroid artery, which is the branch of thyrocervical trunk,
Very good.
which arises from the first part of the subclavian artery, and
Very
the
good.
thyroidema branch of aortic arch.
Right.
And the
venous?
vein, superior and middle thyroid vein, which drain into the internal jugular vein, and the inferior thyroid vein, which drain into the brachiocephalic vein.
Very good. Please now tell me the venous lymphatic drainage of the thyroid, please.
Yes, ma'am. It's drained into the pretracheal and paratracheal lymph node and prelaryngeal lymph node and upper and lower deep cervical lymph node.
Okay, please tell me the embryology of the thyroid, especially the formation of thyroglossal cyst. What is it?
Yes, ma'am. It's arises from the foramen of the cecum and then moves forwards and loop around and beneath the hyoid bone. And the thyroglossal cyst form when the thyroglossal duct failure to fuse, then from the thyroglossal cyst.
Right, incomplete closure of. Very good.
Yeah,
Okay, please tell me at what level would you find thyroid cartilage?
it's in between the cervical 4 and 5.
Very good, excellent. Right, whenever we are undergoing a procedure on thyroid gland, especially thyroidectomy, which nerves are at risk of being damaged?
Yes, ma'am. In relation to the superior thyroid artery, external branch of the superior laryngeal nerve may be injured, and in relation to the inferior thyroid artery, recurrent laryngeal nerve may be injured.
Can get injured. Very good. Please tell me, why does thyroid moves up with deglutition or chewing?
Yes, ma'am. A thyroid gland invests within the pretracheal fascia, which is attached to the thyroid bone and the thyroid cartilage. During the contraction of the digastric muscle, the hyoid bone pulls upwards, which pulls the thyroid cartilage, and it also pulls the prevertebral pretracheal fascia and its content. That's why it
Okay.
moves up with deglutition.
Right. Can you tell me what are the most commonly spread carcinoma of thyroid?
Yes, ma'am. It's the papillary thyroid carcinoma.
Right.
60%
And
maybe.
it spreads through which mode?
Lymphatic
Lymphatics.
spread,
Right.
ma'am.
Okay. Please tell me what are the complications which arise because of thyroidectomy, both acute
Yes,
and late?
yes, ma'am. Yes, ma'am. During the surgery, the hemorrhage,
Yes.
injury to the nerve,
Yes.
external laryngeal nerve or recurrent
Yes.
laryngeal nerve, and immediate postoperative complication may be the thyroid toxic crisis or thyroid storm,
Yes.
wound infection,
Yes. Very good.
scar, scar,
Okay. Scar. Yes.
scar marks, seroma, and the late complication hypocalcemia and hypothyroidism.
Okay. What might be the cause when a patient post-operative thyroidectomy presents with hypocalcemia or carpopedal
Yes, ma'am.
palsy?
I got your question. And the
Thanks.
injury or damage the parathyroid gland.
Right. How many they are in number?
Is there four in number, two
Yes.
superior, two inferior, and the lies posterior to the thyroid gland.
Please tell me the surface anatomy of thyroid gland, parotid gland. I'm sorry.
Parotid gland.
Yes, parotid gland. Oh, sorry, you are not going to cover that
Yes,
today. All
yes,
right.
ma'am.
Okay,
Yes.
next. Never mind. Please
Okay,
have a
ma'am.
look at this image and tell me number 11.
It's the external jugular vein.
Please tell me the tributaries of external jugular vein and where
Yes,
does it
ma'am.
open?
Yes, ma'am. It's the retromandibular vein and the post auricular vein. They drain in the subclavian vein.
Okay, would you be able to have a look at the image on the right hand side? If you can
Yes.
imagine, like if you can identify structure 11.
It's the external carotid artery.
Right. What are the branches of this vessel, this structure?
Yes, ma'am. Superior thyroid, lingual, facial, then
Yes.
then post auricular, occipital, and ascending pharyngeal.
Very good. Okay, thank you. Yes, that was it.